Good morning, everyone. This is Dana Parsons with LeadingAge Virginia. Thank you so much for joining our Coronavirus Weekly Member Update. I'd like to ask if Janine, when LeadingAge, has joined us. I think you might have to unmute yourself, Janine. Okay, well, while we're waiting for Janine, I wanted to make sure everyone knew about our MDS and OBRA PDPM transition webinar that's happening on October 7th. Diana Marsh with the Department of Health is going to be providing an update on MDS, including OBRA PDPM transition, and the webinar is going to provide a review and understanding of all the updates of the MDS 3.0 item sets that will be beginning to use on October 1st of this year, and that is going to provide 1 CEU. So I hope everyone will sign up for that. This call is being recorded, and I am going to check in and see if Janine is with us yet.
You're still a little early, Dana, just so you know.
Okay. Okay, well, I'll give about a minute more for everybody to join us. Janine, just checking in to see if you've joined us.
I just joined. I'm so sorry that I'm late.
No, we ran a little early, so no problem. I just want to welcome everyone to the call again, and just remind everyone about our MDS session that's coming up on October 7th. If you haven't registered, please do. Want to thank Janine for joining us today from LeadingAge. Before we get started with Janine, I just also wanted to mention our call for next week, September 23rd, is not tentative. We are moving forward with that. And Rob Liebrecht, the CEO and president of Goodwin House, is going to be sharing their COVID playbook. So I'm really excited for everyone to be able to be a part of this. They're going to be providing an overview of overall planning, preparing your community, preparing staff, communication, and policies. I'm sure we're going to continue the discussion on testing as well, but that call will begin with an overview and providing you with a copy of their playbook. So with that said, I'm going to hand it over to Janine. She has to leave us at 11:30. So if we could start the chat room as Janine is providing an update, that would be great. So over to you, Janine. Thank you.
No problem. Thank you. And good morning, everybody in Virginia. Happy Wednesday, middle of the week. So I am going to follow up on a few questions I know that came up. I've been trying to send to Dana and Melissa as we've gotten other questions and some follow-up. I still am waiting for a few responses from CMS. But I'm hoping that this overview from the stakeholder call that we have biweekly with CMS and other associations last Wednesday evening will put some more definition on some questions that you had. So first and foremost, I do want to give one update regarding a learning session that we will be hosting on Friday, this Friday, September 18th. It is with BD. So if you are using a BD machine, POC testing machine that you've gotten through the HHS initiative, we are going to be hosting a call with 2 representatives from BD. They will be going over a presentation at 3 p.m. on Friday, and we have the link. We did it through the daily call on Monday. We've been sending it out, and we'll send it out again. That particular learning session that will be from 3 to 4, BD will go over the initiative. They'll go through the antigen testing, talk about some basic parts of the system itself to use the machine. And then they're going to go into some detail then on how to use it, their 5 steps, talk about their webinar series and their e-learning training. They're going to touch on batch testing. I know that that's been a question to using the machine, but then we are scheduling a follow-up learning session, hopefully for the following week. We'll probably know in the next day or so. So it'll be in about a week to 10 days. And that learning session will focus directly on batch testing. Q&A, so you'll be able to ask your questions to the BD representatives. The last half hour, so that session is from 3 to 4, but from 4 to 4:30, myself and Jody and Jill Schumann will be on to talk about the testing rule, the interim final rule with comment, as well as the subsequent guidance and what we know from CMS. So if there's any other questions that you have, we'll try to answer them within that half hour. So again, please sign up for it. It's free. I'm sorry, I forgot to say it was free. And so that's this Friday, September 18th at 3. Okay, so let's just kind of follow through on where there were some questions and some clarifications we've been able to get from CMS. One of the bigger questions regarding the visitation, we know that there's visitation guidance that has been floating around, that CMS has alluded to, that they've been talking about. And so we understand that the guidance for nursing home visitation for residents and families and loved ones is in the queue. We are on pretty good authority that something's going to come out by the end of this week. I don't know what that visitation guidance will have in it, but just so that you know that we're looking for some announcements from CMS in the next day or even today. So as soon as we do, we'll make sure that that gets out to everybody. Going on to testing and about the particular questions, we know that we've sent a lot of your questions to CMS, and then they've stated that they've heard from nursing homes directly. And one of the questions that keeps coming up is about the frequency of testing and talking about prioritization. And so as CMS has stated is that each nursing home looking at their county positivity rates for their staff routine testing and putting that in their plan, how is that going to be put forward for any staff that might be PRN or staff that's on a vacation or staff that works a couple of weeks. And they've been pretty direct in their answer. And their answer is that if there's someone that comes into your organization once a month, or if they're PRN, or if they're on vacation. So if they're on vacation, then when they come back from vacation, they can come in and be tested when their next scheduled shift is. They don't need to come off vacation and come in. So that was made pretty clear. If there's a staff member or consultant or contractor that comes in once a month, you just need to insert them into your testing plan for the next time that they would come back into the building to work. So again, someone that might be a contract pharmacist or maybe a dietitian or someone that might just work monthly in another capacity. What they're stressing is, I know in the guidance it says weekly, and I think we talked about that's kind of the trigger for your testing. So staff that's full-time, part-time, that are there on that kind of weekly, maybe 40-hour-a-week schedule. some are more, obviously part-time is less, but that's who you need to make sure is front and center in the beginning of your plan, and then you insert everyone else as you can, depending on their schedule. One of the other questions that came in having to do with the obtaining documentation. So knowing if you had a consultant or contractor that had been tested a day or two before, and an outside laboratory, or obviously outside your organization, if you are performing testing, they can bring you that documentation. The answer to obtaining the documentation is you do need a copy of it. It's not just okay to see it and mark it off on your organization's documentation. You need to have a copy of that documentation and retain it. And so that would be from any contractor or a consultant. So again, making sure you have a copy of it. Now, I know that I've seen some emails back and forth from your Office of Licensing and Regulatory Affairs, meaning your health department, about the county positivity rates or community positivity rates and how that can be used or not be used. I do just want to tell you what we've heard from CMS. So both in the CMS call that Seema Verma hosted with CDC and HHS and CMS quality clinical standards grouping. And then what I was part of in the stakeholders call, along with American Healthcare Association and AMDA and the NASL, the Association of Long-Term Supports and Services, that they understand that there is some county data that could potentially differ from what's posted on data.cms.gov. And some of that data, which again, from a credible source, is being allowed to be used for your county positivity rate. So staying if that data is newer, faster, or more recent, you can use that data. And again, that's something that you need to work with your Department of Health on. And so with that particular data, then you need to document. You document the source, you document where the data, what the data is, the date of the data, the rate of the what that rate is, and they're using that for testing. So if that is an opportunity that you have through your state, through your county, through any other credible source, if that is an opportunity, then the biggest parts that you need to make sure is that what's on data.cms.gov and data that you're using, that credible source data, is that they're not in two different places. So one isn't in a red, like a red screen, and one isn't in a green screen. Because that is where, when the surveyors come in and look at your data and they're looking to see where you're getting it from and checking from one source to another, if that'll cause any sort of red flags to the survey team.
Hey, Janine, this is Melissa. Could I just interrupt for 1 second? So I just want to be clear that OLC has not said that they are confirming the ability of our members to do that yet, pending CMS putting it in writing.
And I completely I understand that. And
yeah, so I just want to make sure our members know that OLC just has not confirmed that for us yet. And as soon as they do, we will let everybody know. So thank you.
Okay. And we will try to keep pushing CMS if they can put something in writing too. No problem.
That would be fabulous.
No problem.
Yeah.
Yep, we will do that.
And Janine, to let you know, some questions are coming in the chat box as well.
Okay, great. I see one from Lisa Kirby. Okay, perfect. Okay, I'll get to that in 1 second, Lisa. And so the other part had to do with the grace period. And so there's been some questions regarding the grace period, and I know we're coming up on the 3rd week. So that grace period that was put forth, and I know that even Seema Verma herself had brought that as part of her overview during the call last Tuesday. Not this Tuesday, but last Tuesday. That grace period was 3 weeks from September 2nd. You remember September 2nd was the implementation date, but the grace period is for the reporting of results. So if you have a CLIA waiver in order to run the, whether it's the BD or the QuidelOrtho, the point of care testing. And so you have to report, obviously, through you becoming a lab. That's considered being a lab, having your CLIA waiver and using the test. So you still need to conduct tests, and the actual testing is not given a grace period. The grace period is for the reporting of 3 weeks, knowing that some states are still trying to set up their systems in order for reporting. The other part of that what Seema Verma stated, and was stated in our small call with the clinical staff through CMS, is that there will be discretionary periods of enforcement. So when survey teams are coming through and looking at what you've been doing, that there will be some discretionary And that is supposed to go to all regions and be told to all survey teams throughout all states. So I think that was everything that I wanted to make covered. I see the question in here is about a dietitian, for example, comes in monthly. Do we have to test her when she comes in or only if she comes weekly or more? Well, the dietitian has to be tested. So that's number one. What CMS is stating is that if the dietitian just comes in monthly, then you insert the dietitian into your testing schedule for that week or that time frame that she's coming. So if she comes in on the 15th of the month, you need to make sure that she's tested for when she comes in. So you insert the dietitian, he or she, the next time that they're coming in. So if you're testing this, so if you were testing last week but the dietitian doesn't come in until this week, then you wouldn't be testing the dietitian until this week because that's when that dietitian is coming into your organization. I hope that makes sense. And I don't see, I'm making sure that I'm on the chat group. That's the only question that I see right now. But I do, I lost my train of thought for a second when I was answering that question. I remembered it. The other announcement that I think I have made within the last week to 10 days or so are about the Abbott testing kits that are being sent out to nursing homes, which are also being sent out to assisted livings. So knowing that you use that under the CLIA waiver that you have for a nursing home. If you're receiving those testing kits, they're being sent to red and yellow zones right now. They're also being sent to assisted livings, and assisted livings will need a CLIA waiver for those. And so with those particular testing cards, they're supposed to help you with your testing plan. And knowing that it is another opportunity to use testing equipment in this particular case, and that's to help with your workload and to help with any sort of financial burden. I will tell you that I've been hearing this week from members the difficulty in accessing the testing materials. And if you are having any sort of difficulty, again, that's something that you need to work with your, in this case, OLC, make sure I get that right, your Department of Health, and also documenting any sort of issues that you have, along with your turnaround time. So if you have results that aren't cut, if you're sending testing out and sending specimens out to an outside laboratory, that you need to make sure you document within the turnaround time.
So, Janine, I have a question for you because when I reached out to our Department of Health around this, they said that you're only getting these kits if you're an Abbott customer and that you need to work with your Abbott contact to get them.
So that has not been relayed in any meetings that I've been in or any sort of overviews that I've had. It was said specifically that the Abbott kits were going to nursing homes in red and yellow zones, and nothing was ever said about being an Abbott customer, but I will check.
Okay, great. Thank you.
Yep, no problem.
This is Shayna from the Department of Health. I think the important distinction here, is that Melissa?
Yeah,
so Abbott makes
thank
two
you.
Abbott makes two different products. They have the Abbott Binax, which is the antigen testing kit, the cards, which is what that is in reference to. What you were referencing to is the Abbott ID Now, which is the PCR point of care machine. Those are two different things. So what HHS is sending out are the Abbott antigen cards, not the Abbott PCR cards. I know it gets confusing because they're both Abbott products, but they're two different products.
Thanks, Shayna. I'm so glad you're on to clarify. I appreciate it.
Great, that makes
yeah, I know. It's good. Everyone just is saying Abbott, and I was even confused at first. I did clarify with our lab. And
you rock. Thank you.
Thank you, Shayna.
I really appreciate that because sorry I did not say Binax either. Sorry, Binax cards. I just always say cards, but thank you. That helps me out too. Great. Okay, I do see a couple of here. Let's see. Oops, sorry, I skipped ahead there. So how about a fire marshal or people inspecting sprinkler fire detectors? Do they require testing prior to entry? So our understanding is that anyone that's crossing the threshold and going to have any interaction with residents and staff that you need to have them be tested. Because remember, anyone that's coming into your organization could potentially have any signs or symptoms. So you're screening those individuals, and then if they were tested the day or two before. Now the fire marshal, I'm assuming that they might, I don't know what if their particular organization is testing, but again, they're coming into your organization and they potentially could be in contact with residents or staff. And remember, the part about staff is that your staff in your organization, although they might not be in direct care, they're still in the organization potentially interacting with other staff. And so again, anyone that you would be in contact or going through any past any sort of residents or staff. And so obviously sprinklers and fire detectors are in residents' rooms, they're in hallways, in areas where staff and residents would be. So I see construction workers are on site but not in contact with residents. So I'm hoping that is. So if they're not in any contact, I think the example that was used the other day, and I think we've had it also on here, is your groundskeepers too. So they're not coming in any contact with the residents or with staff, with staff specifically, and so that they wouldn't need to be tested.
Janine, we asked our state survey agency
Yeah.
the question about construction workers, and reason I asked is I was hoping to get that response, and they sent the question to CMS.
Okay. Did they get a
So
response? CMS?
no, not as of yet. So I mean, I just wanted to clarify, is that sort of the gauge
Yeah.
about the contact? I mean, that's what we could recommend to, do we
Yes.
have anything from CMS that we can share in writing?
Not in writing. That was all through our small call. It was
Okay.
using the groundskeeper as their example.
Gotcha. Okay,
And
thank you.
It's not coming in contact.
Okay.
So I contacted Abbott on their website and they have not replied. It's been a week. Is that, I'm just wondering if that is is that to help with the Binax cards, or maybe that's with the ID now, because the Binax cards would come directly through from HHS.
Rich, did you want to unmute yourself and clarify?
I was contacting them for the Binax cards, just to see, because it was my understanding we had to contact them to see about ordering extras. I wanted to see about that.
So I think from what was also just shared is that, so the understanding that we have through our contacts at CMS and what we've been involved in nationally is that the Binax cards are coming directly to you if you're in a red or yellow zone, and that you don't need to contact Abbott for the Binax cards.
And this is Shana from the Virginia Department of Health. That is also my understanding, that HHS is directly sending to the facilities, and the facilities do not need to reach out for the Binax antigen cards.
But we have to have a CLIA waiver first, because I have a couple of communities that are in the process of applying.
You need a clear.
Yeah.
Yeah, I'm sorry.
Yeah.
So to answer the question about writing the guidance on frequency of PR, no, they have not put anything in writing. We did try to push for an FAQ and some clarification, and they said that they would decide if they were looking into that. I will tell you, I think that they're really focusing in on the visitation guidance that's supposedly coming out. So yeah, we'll still keep trying to push for something to be put in writing. So the question about delivery personnel, food deliveries, lab, pharmacy, etc. Again, I'm thinking I'm going to just use pharmacy and as an example, and maybe lab, because knowing that, I don't know, lab might be a particular, you might have a box somewhere in the organization where the lab pickup and pickup should not be, well, they're dropping off specimen kits, but that might not be in a area where there is residents. It might be just the kind of that drop-off box. And so if they're not interacting again with staff or residents, then I would say they wouldn't need to be tested. But pharmacy, when they're delivering medications, they're going to med carts, and those med carts are on the units. I mean, even I guess, well, if you have an Omnicell, that's usually still in the vicinity. So, and I would hope that the pharmacy companies that you're working with, you know, knowing that their delivery people are doing that, that they would not have a problem with making sure that they're tested, and they potentially could be tested, and that's someone that you could have the documentation for. And I see you're saying they're less than 15 minutes and no contact with staff. Again, remember, it's the contact part or any sort of interaction that they would have with staff. So even contractors who stay outdoors only but may interact with the facility director. And so again, in that particular case, when we were told having to do with groundskeepers, and I could, you know, if construction's not within the organization, we were told that they don't need to be tested. If they have interaction with the facility director, I mean, obviously everyone would have their PPE on, you'd have social distancing, any sort of infection control protocol and cleaning, as if there's anything that'll be touched. I mean, that would be the best that I can state about that from what we've been told. Our contracted non-emergent stretcher transport company told me that they are not testing their staff at this point, and they are trying to clarify that they are exempt with CMS. To your knowledge, should they be included in testing? What do you suggest about refusing? So the first part I would say is that this is something that CMS hasn't really focused in on EMS. I know that we did bring it up and they didn't kind of bite on that area. So I'm glad that the transport company is trying to work with them also. You know, the way that I understand, the way that what has been explained to us here at LeadingAge is that they're actually going and working with a resident to pick them up for transport somewhere, right? So they're going to be with the resident. And so I would assume that they do need to be tested. I mean, they're going to be not only transporting them from your organization to the van or whatever the transport vehicle is, but then they're going to be in the vehicle with that particular individual in pretty close contact to get them transported out of it to wherever they're going to. The suggestion about contracted partner refusing testing, you know, I know that there are the refusal guidelines through CMS, but that has to do with staff and residents. You know, I would probably just try to have a conversation with that particular partner. I will get to CMS. I have a list that's going to them today, and I will put this on it also. That's about the only thing I can answer right now. I'm sorry. Okay, hold on one second. I just want to make sure I have non-emergent besides EMS. Okay, transport. So question about family members who could be allowed in under phase 3 reopening guidelines. Has anything been established to address family members' risk of entry into nursing homes? No, but I'm assuming that in the visitation guidelines that will be outlined and put into some sort of policy or procedure. But as I said, I haven't seen anything, so I don't know. So that's my guess. For transport, we were thinking no because of logistical concerns on how many people they are and logistical care with not testing. But we are testing our residents weekly who go out regularly. I mean, I would say that that's probably a good part of your plan, to be testing those residents that are leaving your building. But as I said, I'm going to try to see how I can get some follow-up on non-emergent transportation. If pharmacy does not go to the courts, units, neighborhoods, would they need to be tested? I hope I answered that before. Again, thinking that if it is not crossing into where there will be residents or staff, then they would not. Again, remember, it's the interaction. Or for these contractors who aren't there weekly or more, and you're saying we need to test before they come in, can we test them upon arrival, or do you need the test results prior to them coming in? And does the test need to be within X days? Well, obviously, if you're testing them and you're using, so I guess the question, Lisa, would be: are you testing in your organization using the rapid testing machines, or are you sending your tests out? Because you would obviously need to know if they're positive or negative to come into the organization. So. And if you're getting the test results, what was stated was 1 or 2 days. before. So if they're coming with their test results, that was what was stated 1 or 2 days. Again, and that is not in writing anywhere. I hope that was, so my question back would be, if you're sending the results out, then you need to make sure that those results come back. And so I think one part's important. I know we're now at what's today, the 16th of September. And so the last 2,000+ kits, machines, I should say, not kits, the machines with the testing supplies should be being sent out. So if you have not received your POC machine, can you please let Data know, and she'll let me know. Today I was interacting with our person from HHS and have sent some, I know some of you have emailed me, and then also through Dana, but I want to make sure that you're flagged that you hadn't received it yet.
Hey, Janine.
Yeah.
This is probably a rhetorical question, but I'm going to ask it anyway.
Mm-hmm.
I mean, so, we had a member last week where the funeral home workers refused to be tested and caused a lot of confusion. And, the onus continues to be on the nursing homes to try and get people to be tested who are interacting with them. I mean, does CMS understand the additional burden that is placing on our members?
I will say, I think that they do. I think that we were pretty clear along working in the same vein with the American Healthcare Association and on our small call talking about that. There's, again, as I think Melissa kind of using the funeral example, but we kind of spread it out to say, you put these guidelines out, but there's no definitive answers in these questions that we have. And then now you're adding this panic to nursing homes and knowing that materials are scarce. So we've been trying to really make sure that they hear the issues. I think it's also great for members to not only make sure that they let your representatives know the issues that you're having, but you can also advocate through us, and then we'll advocate to CMS. But what I heard is that CMS is also receiving lots of emails too. So I know if anyone has any spare time, it would be good for them to hear your on the ground stories. But we're trying. We keep trying.
Yeah, I know you do. I mean, and I think that, this morning I just heard that, for example, University of Illinois at Urbana is testing their students twice weekly, and yet we still don't have requirements for hospital staff to be tested. And I know that we're working on that as well, but I just think that is, there is such a disconnect and treating our nursing home members as if they are not part of an entire healthcare system. That they're just out there on this island having to fend for themselves. So just wanted, I mean, I know this, and we're working on strategies around it, but I just think it's important for our members to hear that we hear you and we know, and we are working as best we can. I hear it's not easy to have CMS make changes.
No, it's not. It's not. But I will say, and I know this is completely an aside, they did pull back the whole MFAR rule. So we advocated strongly for that all late last fall. And so it can happen. So if we just keep pushing and telling our story, and giving real life examples, whether it has to do with funding, whether it has to do with labor, whether it has to do with just I think the mental anguish also and the trauma, but it's all part of the picture so that CMS needs to know.
Yeah, so members, I think this is really important. Make sure that you are emailing Dana and I those stories so we can catalog them and share them with Janine and our colleagues at LeadingAge National. If you're finding that your staff is saying, I'm not going to work here anymore because I don't want to be tested twice weekly, I'm going to go work at the hospital where I don't have to get tested. I mean, those types of stories are really, really important. So please just take a minute and send an email to Dana and I so that we can continue to advocate for you and talk about the burden that this has placed on you as you're trying to keep your residents safe and provide quality of life for them.
Thank you. So I know I do need to run, but the last part that I want to leave you with, and then, please feel free, you can send questions, you can send them through Dana, Melissa, you can send them to me directly. It's good to have Dana and Melissa on it so that they know also what questions you might have, and especially if something specific for Virginia that I don't have an answer to. But we have a survey. What I didn't touch on is that we do know that it has been reported throughout the country from different members of ours and members of the American Healthcare Association that some of the BD machines are having false positives. So when if that's happening, if you could let us know. But then we have a survey that we've put out there. It's through SurveyMonkey in conjunction with the American Healthcare Association to get some compiling of data regarding the false positives and there's a little bit other information there. If you can please get that completed. I know that was sent out in your update yesterday. I think that's everything I have, and I am sorry that I do need to run today, but again, just please feel free to email me for any questions that you might have, and I will try to get some answers to the non-emergent transports and something in writing regarding the testing PRNs and so forth, and contractors. And so thanks a lot.
Janine, thank you so much, and thank you for all that you're doing. I know you need to run. I wanted to ask if Kim Beasley was on and wanted to respond to any issues or questions that she may have heard.
Hi, Dana. This is Kim.
Hi, Kim. Thanks for joining us.
I haven't been on the whole time, so I'm not sure that I'm up to date on all of the questions.
Okay, one of the main things I guess that we're really trying to deal with are kind of coming up with the test on how to determine when testing needs to occur. I know that you had sent a question for us to CMS about the construction workers, but do you have any comments about really a nursing home making that determination if a person is not coming in contact with residents or staff? Would they be eliminated from the testing requirements? Or are we expecting anything like that? Can you comment?
I did send your question up yesterday, which included, so part of your question included if the construction workers were behind a temporary wall.
Yes.
So I think it depends on, if that's like a real wall or is it just a, plastic, piece of plastic that's up, or a tarp or something like that. So I think it's going to depend a little bit on the specific information. But I do agree with the point that was made earlier about that it's really going to come down to having contact with staff or residents.
Thank you. Would it be okay if we were to open the chat box or open it up for any questions for you at this time?
Sure. Again, I may have missed some of the earlier information.
Okay. If anyone wants to talk, you can unmute yourself or put the questions in the chat box. I'm going to look through the chat box and see here if there's any issue. We were talking about the issue about not having surveyors not being required to be tested. Any developments on that?
No changes there.
Okay, we do have a question. Has the portal been created to report positive and negative COVID-19 results?
This is Shana. Can you hear?
Yeah, she can probably answer that.
Thank you. Thanks, Shana.
Yes, the portal for point of care testing has been created. It went out in a clinician letter a few days ago, and we are going to be putting it on the long-term care facility task force website, the link to that portal. So that is live as of like a couple days ago.
Okay, great. If you have the link, would you be able to put it in the chat box, and we'll also be sharing that as well?
I am on my phone. Can I just email it to you?
Yeah, that's fine. That's fine. That's fine. And then I'll get it out to everybody today as well. So this is a great opportunity for your questions since we have Shana and Kim on.
Dana, I know one of the questions that came up, I believe it was last week, there was a question about using the CMS link versus the VDH or state link for determining the positivity rate.
Yes.
And I did get a response from CMS on that. And basically, I'm trying to find my response. So how the question was posed to them was if there's a discrepancy between the county positivity rate reported by CMS in comparison to the positivity rate reported by our local county or state, which one should we use to calculate the testing frequency? And so their response was facilities should use a consistent source for determining the county positivity rate and document that source and the value for a given week in their testing efforts. Routine testing should be based on the extent of the virus in the community. So in other words, what they don't want to see is flip-flopping back and forth. So for instance, one time using the state data and then another time using the CMS data. So I think they have to pick one and go with it.
Would you be able to share that with us so we can send that out?
I don't have anything in writing. These are my notes from a
Okay.
call.
Okay. Well, if there's any clarification that you can send us, that would be great. We had another question. The department has sent out a survey regarding the COVID-19 vaccine possibly being distributed this fall. Do we have any updates on that?
I do not.
This is Shana. I do not either. I'm sorry, I'm not on the vaccine planning team.
Yeah, I am on that, and I don't have anything additional, any updates from that call to share about that, but as we get that, we will definitely include it in our update. Any other questions? And it is 11:41, so we have about 20 minutes left. Anything
I
anyone?
heard a question.
Yes.
I heard a question earlier related to Abbott testing, and the person was just clarifying if they would need a CLIA certificate, and the answer, of course, is yes.
Do you have any outstanding communities that you're still waiting for the CLIA certificates from?
I believe we are down to 3, and part of it that we're trying to figure out why CMS keeps asking is it may be that there's a discrepancy in the address, and so we're working on confirming. There's 2 of those, I believe, and then there was just one other facility that we were still waiting on to send in their application.
And Kim, could I ask you about routine surveys? So I've been getting questions from members as they are trying to figure out if the department with so much going on is behind, where are we in routine surveys resuming? Are you able to comment on that?
Yeah, so we've been working, according to the CMS guidelines, the resumption of survey activity. We've been working down the list of, the different types of surveys that they opened up. So starting with those 10-day complaints, the non-IJ high complaints, the 10 days, and then of course revisits we've been conducting, and then we've opened that up further into some of our more routine or non-IJ medium and low complaints because, as you can imagine, we have a huge backlog of complaints. So we're working in those complaint investigations. We have worked in our ICF IID recertification surveys. A large number of those we've completed. We have not to date conducted any routine nursing home surveys, but we are certainly looking at the process and how we feel like that can be conducted. So I feel like they'll probably start fairly soon. We've just got to work out those logistics. And the other thing that we have to take into consideration, of course, is that these focused infection control surveys take priority. And it's difficult because we never know how many we're going to have to do from week to week. So it's a little bit difficult in trying to plan, to get those accomplished and then be able to work in other things as well. So we're hoping to start them soon.
Thank you. We have a question that's come in. Is there going to be guidance released as to when we can discontinue testing asymptomatic staff altogether? At this point, my understanding is that this guidance does not exist.
I'm not aware of any additional guidance coming. Not at this time.
Okay. Melissa, did you want to ask your question?
Yeah, so, and I don't know if you'll know the answer to this, Kim, but thank you, or Shayna, but thanks for being on the call. And we could always float it up to Janine if we need to. But we're saying that we have to test everybody who's going to come in contact with staff or residents. But anybody who crosses the threshold has to be screened, including a temperature check. So doesn't that say that everybody that crosses the threshold has to be tested because they've come into contact with the screener?
Pretty much, I would say. Again, I think it's going, a lot is going to depend on the purpose for why the contractor is there. Again, if it's someone who is just on the exterior of the facility, a grounds person or, landscaper or construction type work that's going on where maybe they're not actually, entering in a patient resident area or something, again, it's going to really be a kind of a case by case basis. But my assumption would be if they're coming in and they're going through the facility screening, that's pretty much because they are then planning to enter on into the facility, which would then make them come into contact with other staff and residents.
Okay, Dana, there's another one that's come in. Does the SNF CLIA waiver extend to family members and staff of assisted living on the same campus?
Yes.
Well, thank you so much for the clarification on these questions. Are there any more? We still have some time left, so this is a great opportunity. You can even unmute yourself and ask the question directly if you like. Okay. All right. Well, I don't want to keep everyone. If they're not questions, I wanted to mention again that we have our MDS program coming up. So that's going to fill up. So please register for that. Our call next week is going to be focusing again on testing. And Rob Liebrecht, the president and CEO of Goodwin House, is going to be providing an overview of their COVID playbook. So we really, I know of a member that was really struggling with having policies change because of the requirements changing so often, and they used the playbook and it was of great benefit to them. So I think it's going to be really helpful for everyone. So I encourage you to be on next week. So thank you all. for being on today. And please continue to send me information if you have not received your point of care testing machine, so I can get that information to LeadingAge and CMS. And please continue to send your questions, and we will get responses to you when we can. Hope everyone has a great rest of your week. Thank you.